In this video, I'll walk you through the internal anatomy of the heart. Inside the heart, we have 4 chambers. We have right atrium, left ventricle, and right ventricle. And we see that inside these chambers, we have a layer that is a very smooth layer named endocardium. But when we focus on the wall of the heart, we see that mostly it's made of cardiac muscles. In reality, about 90% of the wall of the heart would be the myocardium, the cardiac muscles. And then the outer layer would be epicardium. Quickly, I pay attention that in the wall of both atria and also both ventricles, we do have myocardium, but the thickest myocardium is in the wall of left ventricle, because left ventricle is the one that has to pump blood to all systems. If you're asking about right ventricle has a much easier job. Right ventricle has to pump blood to the 2 neighbors, the lungs. Between atria, we do have a wall separation. We call that interatrial septum. Between the 2 ventricles, we have interventricular septum. The reason that the right and left side should be separated is because in the right side we have flow of deoxygenated blood, but in the left side we have flow of oxygenated blood. Between right atrium and right ventricle, we have a valve that is called either right atrioventricular valve or tricuspid valve. The reason we name it tricuspid is because if you look at it from above, it has 3 cusps, 1, 2, 3. But between left atrium and left ventricle, we have a bicuspid valve. It has only 2 cusps. The other names for bicuspid valve would be mitral valve or left atrioventricular valve. Then we see that basically from ventricles, when the time comes, blood has to be pushed up into arteries. Right ventricle pumps blood into this artery that is called pulmonary trunk. And at the beginning of pulmonary trunk, we have a valve that is called pulmonary semilunar valve. Left ventricle pumps blood into aorta. And at the beginning of aorta, we have another semilunar valve that is called aortic valve. So inside the heart, we have 2 semilunar valves, these 2, and 2 AV valves, atrioventricular valves. Veins bring blood into the atria. The ones that bring blood into the right atrium, keep in mind they bring deoxygenated blood, are superior vena cava, inferior vena cava, which would be this vein, and here I can see the opening to the 3rd vein. The 3rd vein is called coronary sinus. Coronary sinus is the vein that we see it on the back of the heart, exactly sitting inside the coronary sulcus. So coronary sinus, superior vena cava, and inferior vena cava are the 3 veins that bring blood to the right atrium. And then we said when the time comes, right ventricle pumps blood into pulmonary trunk, which when we follow pulmonary trunk, we see that it divides into 2 branches. So just follow pulmonary trunk. You see that here it divides into left pulmonary artery and right pulmonary artery. These are arteries, pulmonary trunk, pulmonary arteries, because they all take blood away from the inside of ventricle. There are 4 veins that bring oxygenated blood to the left atrium. We call them pulmonary veins. So here I have 1, 2, 3, 4 pulmonary veins. Keep in mind, pulmonary veins bring oxygenated blood to the left atrium. And left ventricle, as I mentioned, pumps blood into aorta, which we divide aorta into 3 sections. Beginning is ascending aorta, then aortic arch, and the rest, which would be a very long artery, is descending aorta.